Hello everyone, my name is Anil Kamath and I am a surgical oncologist and I'd like to talk to you all about breast cancer. So why breast cancer? So breast cancer is one of the most common malignancies. It has become the number one cancer in females in India and also in Bengaluru. So it is very important for everyone to know what breast cancer is, how it presents, how it is investigated and how it is treated. So with this video, I aim to spread information so that it can be of help to one of y'all and also to people known to you. How does breast cancer present? The most common way breast cancer presents is a painless lump in the breast. Most of the patients think that pain is an essential part, but it is very rare to have a breast cancer to have pain in the lump. The lump usually is small to begin with and it gradually grows in size. At the same time, we must remember that not all breast lumps are cancerous. Most of the breast lumps, especially those which happen in younger females, are due to a condition known as fibroadenoma. There may be other conditions as breast cysts. Only a small fraction of the breast lumps are cancerous. But when these lumps happen in older women, our suspicion of cancer increases. Breast cancer can also present without a lump with some sort of a nipple discharge. Especially if there is blood in the nipple discharge, this makes us think more about the possibility of cancer. Some females do not present with a lump but present with thickening of the skin or skin changes or new changes in the breast like nipple retraction or ulceration and such things. A small fraction of the patient present to us directly with spread elsewhere, say to the bones or the lungs. Now, what causes breast cancer? Why is the incidence rising? Now, there is no straightforward answer to it. There are a whole lot of factors which can lead to the increased incidence of breast cancer, some of which we know and many of which we still do not know. What we know about certain factors is that certain things increase the risk of breast cancer. One, of course, smoking. Apart from a whole lot of other cancers, even breast cancer is related to smoking. Obesity. Those who are obese have also at increased risk of breast cancer. Other things like late pregnancy, not having breastfed the child, these are not surefire factors but are known to somewhat increase the incidence of breast cancer. About 5 to 10% of breast cancer are genetic. That is, it can run in families. When I say this, we must also remember that the most of the breast cancers are not familial, that they do not run in families. But when there is clustering, that is, there are many members of the family getting breast cancer, say the patient, her mother or mother's sister or father's sister, there are like so many blood relatives getting, this increases our suspicion of breast cancer. And this is when we look at the possibility of breast cancer being hereditary. The next thing to understand is that when these symptoms are there, what are the tests that we do? First of all, to know more about the lump, we may order a mammogram. Mammogram is basically an X-ray of the breast where X-rays are taken in two different angles and it is seen, and lumps very small which are not palpable by the hand may also be picked up by the mammogram. So based on the mammogram, the radiologist gives a category. It is known as a BIRATS category from 1 to 6 depending on the suspicion of breast cancer, where 1 being very low and 6 being almost confirmed that it is breast cancer. So anything up 3 and above requires at least you to consult an oncologist to get the lump evaluated further. The next test which we do is a biopsy. This may be either through a needle test, what we call as a FNAC, or we may take a much bigger tissue with a bigger needle, what we call as a true cut biopsy. The sample is sent to the pathologist to confirm that there is cancer and also to send for further tests which will help us determine the treatment. After the test is available and there is a confirmation that there is cancer, we may order for other tests like a PET scan which sees where all the cancer has spread. So in this video, I have given you a broad overview about the causes, the symptoms and the investigations done for breast cancer. Thank you.